Many Malaysians were forced to draw down their savings to cope with the impacts of the pandemic. Among EPF members, some 6.1 million people have less than 10,000 ringgit left in their accounts. According to Dr. Hafezali Iqbal Hussain from Taylor's University, the situation has exposed the lack of social protection in dealing with adverse shocks in the economy, especially for those who are self-employed or working in the informal sector.
This brings about the bigger issue, about the issue of social insurance pillars, such as unemployment allowance, Most of these benefits tend to accrue to the formal sector workers who can afford to make the contributions, And this sort of pillars tend to neglect, people who are working in the informal sector, They cannot access social insurance benefits due to non-contribution, They are often left behind in means-tested, tax-funded social assistance, In terms of coverage and adequacy, the social protection remains a pressing issue in Malaysia, where almost half the working age population do not have any specific social insurance scheme.
The gap between those who will be able to securely retire and those who struggle is likely going to grow. And fueling this problem is income inequality.
So the focus from the government's point of view is ensuring affordability of good and quality food, affordable childcare, and access to early years education. All of this adds up to reducing income inequality in the long run. Instead of targeting inequality explicitly, the policy focus should be a paradigm which has shifted towards a life cycle approach. So the target should be looking at core risks such as disability, sickness, unemployment, old age, childhood. And this is going to ensure that everyone or the entire society is able to overcome and resilient to shocks. So we can overcome these catastrophic threats throughout our lifetime.